Health of our community's children has taken a dive, with more kids and adolescents than ever before needing care, and quickly. But as 23 News morning anchor Marta Berglund found out, when parents and kids in the region need help the most, it's not often there.
Honestly, there's been times where I wanted to give up because everywhere I turned and everywhere I fought, there was nothing.
Laura Nation describes the low points in the fight to get her 16-year-old daughter, Ari, inpatient mental health treatment. And she's not alone.
And a lot of parents are at this end. We've fought the system. We've butted heads.
Nation is talking about the system that provides residential or hospital care to kids and adolescents with urgent mental health needs, like severe depression, suicidal, or homicidal ideations.
Before everything, she was very outgoing, but her mental health took a turn. It's been a battle for about the last 3 years.
16-year-old Ari has dealt with severe anxiety, depression, self-harming, and dissociative disorders, to name a few. Her mental illness came to a head when, during a dissociative episode, she burned the family house down.
And through everything, she's always fought and always managed to come out smarter and stronger.
High acuity mental health care options for children and adolescents are severely lacking across the country, including here in Illinois. The state's Department of Public Health data showed in 2020, 8,920 kids between the ages of 5 and 17 visited the ER for mental health reasons. In 2022, that number climbed to 11,500.
The demand that's needed in child and adolescent mental health is higher than any other medical field.
Dr. Ode Alsaroff is a child psychiatrist at UW Health. Its Swedish-American hospital is the only inpatient ward in the area for young people with severe mental health issues. The unit's 16 beds must serve the entire region. 2023 data from the American Academy of Child and Adolescent Psychiatry showed all counties in the state line have a severe shortage of child psychiatrists. They're the ones who can diagnose and prescribe medication for mental health disorders. Winnebago County has 10 child psychiatrists per 100,000 children. DeKalb County has 4. All other counties in our area have 0. Another report released by the governor's office revealed 40% of children who had a major depressive episode in the state last year were unable to get care.
Anyone who's going to be able to deal with mental health problems of kids and adolescents, we need more of.
For Laura and Ari, this shortage means they've gotten what they describe as the runaround, trying to find care.
We tried every avenue of finding an inpatient mental health. Chicago was full. Everywhere around here was full.
Laura says she's been told to look as far as Arizona to get consistent care for her daughter. Dr. Alsaroff says he frequently sees patients like Ari multiple times, with 13% of kids hospitalized for their mental health suffering repeat episodes within 6 months. That's according to JAMA Pediatrics.
Generally, that lasts months or maybe a year or two.
And the severity of mental health issues has heightened in younger children. Dr. Alsaroff says he sees kids as young as 5 years who need immediate attention.
Thoughts of harming themselves, thoughts of harming someone else. But when you dig a little deeper, what you find is that there are other disorders and other illnesses that these patients struggle with.
Licensed social worker Laura Mulliken works with many of these young people and their families throughout their mental health journeys.
Hearing the desperation, well, I've called several other places and there's waiting lists. They're kind of at a wit's end, not knowing what else to do.
She says inpatient treatment is a last resort, but when it comes to that, she sees families' desperation for help firsthand.
And that's really traumatizing for kids to be taken out of the area, farther away from their families.
Laura and Ari say when treatment hasn't been available, the alternative is much worse. Ari was put in a juvenile detention center 3 times. Her mom attributes her visits to untreated or mistreated mental health issues. There, without hospital care, Ari's self-harming escalated.
It was heart-wrenching. She was angry and I couldn't do anything, and everything I tried felt like it failed.
In February of this year, the governor's office announced plans to overhaul the state's services for young people. The Children's Behavioral Health Transformation Initiative worked to identify and report weaknesses in the system and come up with a coordinated approach to fix them. This includes a new online portal to search for treatment options and more frequent screenings in schools. $22.8 million were earmarked in this year's state budget to implement new programs. Neither Mulliken or Ulceroff have given up hope.
It does concern me a lot. I have several clients right now that haven't had great experiences with the local programs. Certainly I'm hopeful that that will improve.
It's pretty severe. I wouldn't say it's urgent to the point where we should panic, but it's severe enough where we need to be training more mental health professionals.
As 16-year-old Ari progresses through the youth court's mental health system, she and her mom attribute animal therapy and consistent medication to her improvement. Despite this, Laura knows her daughter's mental health journey is far from over.
Do you think she ever got the treatment she needed?
No.
Working for you in the Stateline, Marta Berglund, 23 News.
Another barrier for many families is affording this mental health treatment. Hospital treatment is usually covered by insurance, but that's not always the case at private practices.